Today, as a board, we're confronted with a choice in terms of which direction we want to, as a board, express our desire to see the medical care provided in our correctional facilities go. The sheriff has proposed a effort to begin the process of outsourcing, and with a high probability that it will go to a private for-profit entity, most likely WellPath. And that is a choice that I believe will not lead to good outcomes. And I think that we have ample history and documentation to show us the perils of moving forward with that approach. On the other hand, there is a better way that we could move forward. And that would be taking the time to actually develop what a coordinated, integrated system of care would look like, run and administered by our Health and Human Services Agency with the expertise they have, and naturally linked in the continuum of care with the care that individuals are likely to receive when they come out. And that is a choice that, although the ultimate authority is the sheriff's and what he wants to do, as a board, we have the ability to express the direction that we think will get the best outcomes. Because ultimately, as a board, we are the ones who are on the hook for when things go wrong and the lawsuits that happen. We're also the ones that are on the hook for these individuals when they come out and they aren't linked to a continuum of care and their health care has not been improved, and they cycle through a perpetual thing of in our psych hospital, out of our psych hospital, homeless, in our psych hospital, back in jail, out of jail. We share the financial obligation for that back end of it. And I think we should have input and we should weigh in on the decision and the direction and path that we should go as a county. I don't agree that the current system is working. I think the current system is disjointed. I think that with 26 different contracts and with public health workers, I think that there are real challenges with the current system. As I talk to county workers who are in our jail system, both sworn and non-sworn, I hear about a system that's underfunded. I don't think we have enough jail nurses, in particular, nursing staff in our current system. I hear directly from employees about the conflict that exists between medical staff and sworn officials. And there may be an official policy that no medical choice is made by anyone other than the medical professionals, but when they have to ask permission to get someone treated or to have someone come in to treat them or to go see someone, and that permission is denied, that is a de facto putting the sworn officers in a terrible situation of making healthcare related decisions. Even if that's not the stated policy, that is what is happening in practice. I hear directly from folks about the concerns with data integration and how it works and how it tracks, particularly in the transfer upon discharge. And I hear directly from employees about the issues and concerns of morale. And morale in a system of morale that is only being exacerbated by threatening to take the jobs of hundreds of county employees that we just spent time in this board meeting praising. And so I believe that our system should change. The disagreement or difference of opinion is which way we will go. And the jail report that Supervisor Jacob and I asked for from Dr. Venter specifically outlined that we needed to make a conscious decision about, are we here to provide triage care during incarceration, or are we here to provide an opportunity to improve overall health care and the health status of these individuals? And I think that that is an informed choice that must be made by allowing Health and Human Services to have the time to develop what it would look like if we went a different way. Merely saying that they can respond to an RFI in a few weeks is not being intellectually honest with the reality that they are not going to be able to compete with the cut and paste template approaches of all of the entities that are out there in correctional space now. I believe we should take the time to allow Health and Human Services to truly develop what an integrated, comprehensive approach would look like and be able to weigh that in its totality. And in the interim, I think we should increase staffing in our jail nurses in particular to provide the greatest care we can while we make what is a very important decision. I would also point out that we have been warned about the dangers of for-profit entities that seek to come into this field and seek to come in and do this. I would point everyone here to a number of reports, an exhaustive CNN report last year, which outlined, it's easy to dismiss a lawsuit as someone, well, everyone gets sued all the time. The thousands of lawsuits that have taken place from allowing for-profit corporations who have a focus on the bottom line to be put in charge of making decisions about wellness of individuals who are there. The instances where they've outlined specifically that cost containment is the strategy in terms of maximizing profit. The issues of documents being shredded. The instances of in a financial disclosure to investors, these same entities saying that lowering recidivism is a threat to their business model. The simple reality that we're talking about a $40 billion market, that you have in particular private equity companies coming in to figure out how do we squeeze every dollar we can of profit out of the system while privatizing the profit and socializing the risk. And the risk that gets socialized not only to the individuals who don't get good care, it will get socialized to this board, because we will be the ones who will have to pick up and pay for the pieces of a system that is not providing better outcome. And so I think that there is a better approach, and I think it's worth us taking the time to thoroughly explore what that would look like and what we would do. We've seen examples where this doesn't work. Again, there's a new lawsuit just last week around Alameda County, one that was just highlighted as an example. We've seen in Santa Barbara having to pay out class action lawsuits because this same approach did not work. And we can learn from those and have those guide our way. And then we can also look to other places that have learned the hard lessons that we shouldn't have to learn. Look at Rikers Island 4 years ago. They finally accepted the reality that the best outcomes they would get would be to do a version of exactly what we are proposing. They provide evidence-based assistance for those with serious mental illness, to the regular difficulties that come from being incarcerated. They're celebrated for their innovation, their around-the-clock care. They have specialty housing units for individuals with SMI, 24-hour on-call psychiatric services, clinics in each of their facilities, substance use treatment, integrated re-entry services, and relationships with multiple training institutions throughout the city. They continue to be an ongoing effort, and no system we're going to put in place will be perfect. This is a very challenging and difficult population. But I think the question before us is, are we going to take the path of least resistance and quickly go down the path of privatizing and outsourcing these, or are we going to roll up our sleeves and do the hard, difficult work about creating an integrated system that provides the opportunity for these individuals to get the best possible care they can and most successfully sets them up for reentry and begins to stop the revolving door cycle and process. And so I would urge our board to adopt our board letter. Let's take a halt on an effort around outsourcing or privatizing. Let's do the hard work to put together what a different approach would look like. And then let's be able to present to the public and to the sheriff some informed plans that can guide the decision-making moving forward. Thank you. Mr. Chair, if we could, I'd like to make a motion to adopt the recommendations in item 22.
Okay, there's a motion to accept the recommendations in item number 22. Is there a second to that? A motion dies for lack of a second.